Hi, my name is Michelle Perez. I'm with Keller Williams, and I'm here with Dr. Angela at Allergy and Asthma Care in Wylie. And you are located off of 78 and really close to 544. So, kind of behind where the Brookshires were.
Yes,
so
that's what I tell people.
Easy to find. So, Dr. Angela, tell us what brought you to Wylie.
Yeah, so I grew up in Louisiana, but my husband is from the Dallas area. We knew that whenever we were ready to finally find a place to settle, that we would come back to be closer to home with him in, growing up in Duncanville. But then I also have family here as well, and lots of college friends that have settled here. So when it came time to figure out, okay, where in the Metroplex did we want to be, considered a few different places, but really felt like when we had a chance to visit Wylie that it was home, and that, the people were personable. It just felt like a community feel, and so here we are. And
well, we're glad to have you.
Yeah.
So what got you into this field versus anything else medical? Why allergy and asthma?
Yeah, so I grew up with allergies. So suffered with them all my life, and didn't at the time, being a child, know what it was. I just thought that was just, a normal thing. Everybody has this. But then as I got older, started to suffer with it more, and eventually saw an allergist. My primary care doctor referred me to an allergy specialist. Before then, I had no idea that the field even existed, to be quite honest. And so after being under treatment with them, really started to notice a difference in the quality of life that I was experiencing. So I like to tell the story of, being from Louisiana. We took a field trip to our state capital, like second grade, and there's this big green hill that you can roll down. Second graders, that's what you do. So we rolled down the hill, and I got up and I was itching everywhere. All the other kids were like, "Oh, that's fun, let's do it again." And I was like, "Absolutely not, we're not doing that again." And again, like I said, I didn't know what it was. I didn't have a name for it, but I just knew that things were a little bit different, and I just thought, that there's nothing that could be done about it. So that's what led me to allergy.
Well, that's good, because being in Texas, we have a lot of allergies.
Yeah.
Today's a super windy day, and I can feel it hitting.
So,
do allergies typically, is that more of a kid thing, or will it hit you, just you won't have it at all, and then as an adult you're like, what's going on?
So all ages, and in our training we actually, as allergy specialists, train to see pediatric patients but also adult patients, because it can strike at any age. We do of course see more of it in the pediatric side, when you're thinking of like the seasonal allergies, but certainly most people don't grow out of that. And if you're changing locations, a job or something, you're at risk of potentially developing an allergy based on the new location that you're in. So you can be, 4 or 45. There's no, certainly no discrimination as far as allergies are concerned with age.
Okay, and if there's a new mother out there and their child starts, feeling like you did as a child, they're not necessarily going to know to go to an allergist. What can you tell people kind of what to look for when it's time to not go to the pediatrician anymore and see a specialist?
Yeah, so what I always tell people is when over-the-counter medications aren't working, so your Zyrtec, your Claritin, your Lever, whatever your flavor is, your preference. There's also, of course, lots of nose sprays and stuff that you can, get over the counter as well. When that stuff isn't working, then we've got to figure out, okay, what exactly is causing all of these symptoms, the runny nose, the congestion, the watery, itchy eyes, breathing issues, whatever it may be. And then that's where we come in to try to get to the bottom of exactly what those triggers are, and then help you to make a plan about how to avoid them, how to treat them specifically, and not just the symptoms themselves.
Right, and like I said, told you earlier, I have a 30-year-old that went through this years ago when he was elementary, junior high. How do you treat it now? I know what they did then. Has it changed that much in the last 20 years?
Some. So of course we still offer, allergy shots, which are very, very efficacious for most people. At least 80% of people do see benefit with allergy shots if they're continuing on that regimen. But there are newer treatments now, depending on exactly what your allergies are. So there are some that are called sublingual, so under the tongue. It's limited to just a few different categories, but certainly that's an option for someone who just can't come in, you know, every week for several months to continue with that regimen. And wants another option.
So that's something you can send home with them.
So you would still, at least initially, the first few visits, have it here in the office, but then after that, it is something that you can do.
Oh, that's convenient, especially when you have multiple children that you're trying to get to different things. You can't, it's not necessarily easy to come to the doctor every week. I remember that. Yeah. That was exhausting. Okay, and as far as the testing goes, is it still the same way?
Still the same.
The little pricks all over the back?
Yeah. We do have, at least, you know, you can do like 8 at a time, so you're only doing, you know, maybe 6 different panels, 7 different panels, but it is still skin prick testing. Is there a recommendation based on age how many somebody should get tested for at the same time? It doesn't matter? No, there's not a recommendation. I usually will do it, and the way that I was trained to do it is if you got a small child, obviously there's only so much space that you have to do it, so you would do a limited panel in the instance that you can't fit your full panel. But certainly an adult, someone that's full size, if we can do the full panel, we want to do that so that we can identify any and everything that may be causing an issue for you.
Okay. And on the asthma end of it, they used to say that, especially in lower income housing, because of like roaches and things like that, that it triggers the asthma. Is there other things besides, because we're all familiar with that story, so are there other things that people can avoid if you see your child having trouble breathing?
So it can be anything allergy related, basically. So your tree pollens, your grasses, of course inner city things, cockroach or mice or rodents. Can be a trigger as well, but we've still got all the other environmental outdoor things to consider, no matter where you live. Unless you live, in Antarctica or somewhere, there's still going to be something that can potentially, if you're allergic to it, flare up here, and then also, one airway, flare up your lungs.
So if you're allergic to mountain cedar and strawberries, you could actually have an asthma attack from that?
Mountain cedar, yeah, it's a pollen, airborne. Strawberries, like the food, is what you're referring to. So not necessarily an asthma attack specifically, but what you'll have is an allergic reaction, potentially an allergic reaction that involves the lungs. So it may not necessarily be called asthma, but the other thing to consider too is someone that has asthma that's not well controlled and they have a food allergy, then that puts them at risk for this flaring up even more so if they are exposed to that particular food.
Okay, and if you have a child that has bad asthma or even a little bit of asthma, if they're away from their nebulizer or their inhaler and they have an asthma attack, is there something they can do to calm that down if they don't have their medication?
Really the best is to always have something on you. So that's why even when we have small or younger patients, they may prefer the nebulizer just for the convenience of, getting the kid to actually inhale properly with that. But I always prescribe the rescue for at school and for at home. So no matter where you are, where the child is rather, they've got access to that. As far as other treatments, there's really not anything that's necessarily going to open up the airways the way that those medications do. You can try just kind of deep breathing, trying to calm down, but it's hard to get somebody to calm down when they feel like, they're not getting air in and out.
Somebody told me one time coffee will do it. And I always wondered, I never did, because I don't drink coffee, so I never had even that. So I always wondered if that was true.
I've never read that is
one of those old life sales, this is a long time ago, so you never know. Okay, well, it sounds like there's a lot of factors out there involving your allergy and asthma, so don't just try to figure it out on your own, especially if your child or even yourself is having bad symptoms. Come to see you.
Yeah.
Okay, well, I really appreciate the time that you give talking to me and letting me know, what it's all about. Again, seriously, this has been too long. So anyways, if you have any questions for Dr. Angela, I will have all her information posted at the end of the video. I've found you on Facebook, and then of course a phone number and email and all of that. So, and if you think you're having any problems, just come up here. She'll help you out. If nothing else, even if you don't need tested, you know, it might be peace of mind just to make an appointment.
Yeah, absolutely.
Okay, well, Dr. Angela, thank you for your time.
Absolutely.